What would you do if saving someone else meant destroying yourself? My name is Daniel Foster, and I'm a GP in South London. I've seen thousands of patients, heard countless stories, but nothing, absolutely nothing, prepared me for the day Shanice Williams walked into my surgery with a smile on her face and death in her blood results. She was dying, and she already knew, but that's not the story. The real story is what she did next, and why it almost killed her daughter instead. It was a Tuesday morning when Shanice sat across from me in that familiar NHS chair, the one with the slightly torn armrest. She was 43, worked as a teaching assistant, always impeccably dressed despite the early hour. Her emerald green blouse brought out the warmth in her dark brown skin. Her sister locks were pulled back in an elegant bun. I looked at the results on my screen. Stage 4 kidney disease. Rapidly progressing. She needed a transplant, and she needed it soon. Shanice, I'm not going to sugarcoat this, I began. I know, she interrupted, still smiling. I felt it. The tiredness, the swelling. I've known something was wrong for months. Then why didn't you come in sooner? Her smile faltered for just a second. Couldn't afford to know, could I? Not with Maya's A-levels coming up, not with the rent increase, not with... She trailed off, then straightened her shoulders. But I'm here now. So what do we do? I explained everything. Transplant list, dialysis, lifestyle changes, the whole protocol. She nodded at everything, took notes, asked intelligent questions. Then, at the end, she asked, how long before I can get back to normal? Maya's got her university interview next month, and I promised I'd go with her to Bristol. I had to be honest with her. Shanice, without a transplant, you're looking at months, not years. And even with one, normal is going to look very different. She absorbed this like she was hearing the weather forecast. Right then, we'd better get on with it. I'd never met anyone so calm about their own death sentence. 2 weeks later, I got a call from University College Hospital. Shanice's daughter Maya had gotten herself tested without telling her mother. Perfect match. 6 antigens. The transplant team said it was one of the best matches they'd seen in years. Maya was 19, first-generation university student, had a conditional offer from Bristol to study medicine. Bright kid, her whole life ahead of her. When I rang Shanice to tell her the good news, there was silence on the line. Shanice, this is incredible news. Maya's a perfect match. No, I was confused. Sorry. I said no. I'm not taking my daughter's kidney. But Shanice, she's willing. She's been tested. Dr. Foster, with respect, this conversation is over. She hung up. I sat there, staring at my phone, completely baffled. A perfect match, a willing donor, and she just refused. 3 days later, Maya stormed into my surgery. And I mean stormed. She was furious. She's being selfish. Maya paced my office, her box braid swinging with each turn. She looked so much like her mother, same bone structure, same determined chin. I'm an adult. It's my body. It's my choice. And she's just going to die because she's too proud to accept help. Maya, please sit down. She sat, but her leg bounced anxiously. Your mother isn't being selfish. She's being a mother. That's rubbish. A mother would want to live for her child. I leaned forward. A mother would also want her child to have 2 functioning kidneys, no surgical risks, and the ability to become a doctor without health complications. Maya's eyes filled with tears. So what? I'm just supposed to watch her die? Plan her funeral while I'm at uni? Live my whole life knowing I could have saved her, but she wouldn't let me. I had no answer for that, because honestly, I didn't know what the right answer was either. Over the next few weeks, I learned the full story. Shanice had been carrying this family alone for 19 years. Maya's father left when she was 2. Shanice worked 2 jobs, teaching assistant during the day, cleaning offices at night, just to keep them in a decent flat, in a good school catchment area. She never dated, never went out, never spent money on herself. Every single pound went toward Maya's future. Piano lessons, tutors for the 11+, school trips she could barely afford, university application fees. I started visiting Shanice during her dialysis sessions. Partly professional concern, partly because I genuinely cared about what happened to her. I always told Maya she could be anything, Shanice said to me one afternoon, watching the machine clean her blood. Didn't matter that we didn't have money. Didn't matter that we didn't have family helping. She could be anything if she worked hard enough. She paused, staring at the tubes connected to her arm. But if she gives me her kidney, she can't be anything anymore. She'll have medical restrictions. She might not get accepted into medicine with only 1 kidney. You know how competitive it is. And what if something happens to her remaining kidney? Then she'd need a transplant, and it would be my fault. Shanice, people live full lives with one kidney. Maya knows the risks. She's 19. Her voice rose, startling the other patients. She lowered it again. She's 19, and she thinks she's invincible, and she doesn't understand that every choice has consequences. I understand. I'm her mother, and I'm telling you, I will die before I let my child sacrifice herself for me. It was 2 in the morning when my phone rang. UCL Hospital. Shanice had collapsed at home. Maya found her unconscious in the bathroom. Emergency dialysis. Touch and go. I shouldn't have driven to the hospital. She wasn't even my patient anymore. She'd been transferred to the transplant team. But something pulled me there. When I arrived, Maya was in the corridor outside ICU, sobbing so hard she could barely breathe. A nurse I knew, Claire, was sitting with her. She coded. Claire told me quietly. Twice. They got her back. But Daniel, it's not looking good. Maya looked up at me with devastated eyes. This is my fault. If I'd found a way to make her accept. I could have lied, said I'd already done it, something, anything. Maya, no. This isn't your fault. She's dying because she loves me too much. Maya's voice cracked. What kind of backwards, horrible world is that? What kind of love kills you? I sat down next to her. The mother kind. When Shanice stabilized, barely, temporarily, they let Maya in to see her. I watched from the doorway as this 19-year-old girl held her unconscious mother's hand. Mum, Maya whispered, I know you can hear me. And I know why you said no. I get it. You've spent 19 years putting me first, and you think this is just one more thing you need to protect me from. She wiped her tears with her free hand. But here's what you don't get. You taught me to be strong. You taught me to fight for what matters. You taught me that love means sacrifice. And then when I try to do exactly what you taught me, you won't let me. She leaned closer to her mother's face. You want to know what would actually destroy me? Losing you. Going to Bristol alone. Becoming a doctor without you there to see it. Having kids you'll never meet. That's what would break me. Not giving you a kidney. Watching you die when I could save you. Shanice's eyes fluttered open. Barely. She looked at her daughter with such love and such pain that I had to look away. Maya. Her voice was barely a whisper. You have so much life. And I want to live it with you in it, Mum. Please. Let me save you. Let me give back just a fraction of what you've given me. The transplant team called it the most complicated case they'd handled, not medically, but ethically. Dr. Okonkwo, the transplant surgeon, sat them both down. Shanice, she said, if you refuse this transplant, you have perhaps 3 months. Maya will watch you die, and she will carry that for the rest of her life. She will wonder if she pushed hard enough. She will blame herself. Then she turned to Maya. And Maya, if your mother accepts, you will have 1 kidney. You will have restrictions. Medical school will be harder. Some programs might reject you because of the perceived risk. This will change your life permanently. She looked between them. So here's my question to both of you. What does love look like? Is it Shanice dying to protect Maya's potential future? Or is it Maya sacrificing perfect health to give her mother more time? Because from where I'm sitting, you're both being incredibly stubborn, and you're both motivated by the exact same thing, love. The room was silent for what felt like forever. Finally, Shanice spoke, her voice breaking. If something happened to you because of this, I couldn't live with myself. Mum, Maya said firmly, if I let you die, there won't be a self left to live with. Please, I'm begging you. Let me do this. The surgery took 8 hours. I wasn't there, I'm not a surgeon, and I wasn't officially involved in the case, but Claire kept me updated via text throughout the day. Both patients stable, kidney functioning immediately, mother crying, daughter asking if she can still play football. That last one made me laugh out loud in the middle of my evening surgery. Shanice had finally accepted. She'd finally let her daughter save her. Maya started at Bristol, deferred by a year, but she started. Shanice went with her to move into halls. They sent me a photo, both of them grinning in front of the medical school building, Maya in her Bristol hoodie, Shanice looking healthier than I'd ever seen her. The message said, Dr. F, thanks for everything. Also, Mum wants you to know she's joining a support group for kidney recipients. Something about the wasting all this extra time I've been given. Maya. I saved that photo. Still have it on my phone. A year after the surgery, Maya came back to my surgery. Not as a patient, as a volunteer, doing a placement before her 2nd year. Has your mum? I asked. Driving me mad, honestly. She's joined 3 different community groups, started a blog about kidney disease in black communities, and she's dating someone. Dating? At 45. It's horrifying. She was grinning as she said it. And you? Any regrets? Maya paused, then pulled up her sleeve to show me a small tattoo on her wrist, 2 kidneys, stylized, with tiny hearts between them. Dr. Foster, I gave my mum a kidney. She gave me everything else. Seems like a fair trade to me. Here's what Shanice Williams taught me. Sometimes the hardest thing we can do is accept help. Sometimes strength isn't about handling everything alone. It's about letting the people who love us carry some of the weight. Shanice spent 19 years being strong for Maya, teaching her resilience, sacrifice, determination. But the final lesson, the most important one, was learning that love isn't just about giving. It's also about receiving. It's about trusting that the people we've raised, the people we've loved, are strong enough to make their own choices about sacrifice. The woman who wouldn't take her daughter's kidney taught me that sometimes the most loving thing we can do is let others love us back. Shanice wanted to give Maya the world. Maya just wanted her mum in it. And in the end, they both got what they needed.